Months of delay coming to an end today as the new state-of-the-art multi-million-dollar critical care block officially opened.
Well, the commissioning ceremony for the new state-of-the-art facility wrapped up just a short while ago. The block includes a new central sterile department, 20 private intensive care unit rooms, and 18 recovery beds, among other things. That now ushers in a new era in health. Clint?
Candino, charisma, indeed, it is a new era in the Commonwealth of the Bahamas with the opening of the new Princess Margaret Hospital critical care block coming in just under the tune of $100 million, some $50 million in, of course, construction and just under $40 million in furnishing this new establishment. It is indeed a red letter day for the Bahamian people. Officially opened moments ago by Prime Minister the Right Honorable Perry Christie, of course Governor General Dame Marguerite Pindling, Her Excellency Dame Marguerite Pindling, Leader of the Opposition Dr. Hubert Minnis, former Prime Minister the Right Honorable Hubert Ingram also here, and many dignitaries, Minister of Health Dr. Perry Gomez, all witnessing the unfolding of the commemorative cornerstone and of course cutting the ribbon to open a new care facility, a quality in the Bahamas. We can tell you today, Prime Minister Perry Christie, along with those speaking, Chairman of the Public Hospitals Authority, Frank Smith, Managing Director, Herbert Brown, and indeed the Minister of Health, the Honorable Dr. Perry Gomez, all sanctioning today as an historic day, one where healthcare now made affordable to Bahamian people, the best in the region, they describe it. Let's take a listen at the official opening ceremony, highlights from that earlier today.
I cannot help but recall that poignant verse of scripture, "Nothing they plan to do will be impossible for them." And in the context of the Commonwealth of the Bahamas, an island nation with the attendant challenges of an island nation, where there is no model in this region and even in this hemisphere by which we can measure and judge ourselves, we must recognize the powerful meaning of being able to think big, plan big, and execute big, and this is evidence of it.
This critical care block provides an opportunity for us to positively impact the length of stay by causing an overall reduction. In the face of this public demand for service, the hospital has had to change and grow over the years.
And of course, indeed, one of the key things standing out from Prime Minister Christie as he addressed those that gathered today was the importance of saying that for too long Bahamians have died either because they were poor and black and didn't have the money they need to afford to get quality health care. He says that this critical care block now affords them the opportunity to live, particularly when they have dire needs of medical and health care. And also it's a good forerunner to what the government will introduce in 2016, National Health Insurance, to ensure that every Bahamian can afford quality health care regardless of what it costs. And of course we know that quality health care, a good environment, is a first step to feeling positive about the job. And as you would have seen on your screen, the Prime Minister and his delegation, and Prime Minister and many government officials, former Prime Minister, you can see in the background, all touring the facility today, getting a first-hand tour of what the entire critical care block includes. A number of rooms, neonatal care unit, pediatric unit, intensive care private rooms, 60 operating theaters. Indeed, a facility many people have described that as worthy of the budget. I'm Clint Watson, back to you in the studio.